Hi, welcome to Common Terms in Healthcare Supply Chain. As a healthcare supply chain professional, the terms presented in this video will help empower you to communicate effectively with your supply chain colleagues and other healthcare professionals. This video is presented by Trident Edge Consulting, where it is our mission to provide thoughtful instruction, tips, and guidance on healthcare supply chain topics to passionate supply chain professionals just like you. What is a supply chain? A supply chain is a network of individuals, organizations, resources, activities, and technology involved in the creation and sale of a product or services. It includes the sequence of processes involved in the production and distribution of goods and services. What does a purchasing department do? A purchasing department is the division of a health system that is responsible for acquiring the goods and services that are required to operate. Some responsibilities include ensuring that orders are sent to suppliers and managing order exceptions. What is logistics? Logistics is the process for managing how resources are acquired, stored, and transported to their final destination. What is FIFO? FIFO, meaning first in, first out, describes how goods are stored and issued to minimize the risk of aging and expiration of products. Quite simply, the first good or unit to enter the warehouse is the first one out. A just-in-time or JIT inventory model is a form of inventory management that requires working closely with suppliers so that materials arrive almost exactly when they are needed. The goal is to have the minimum amount of inventory on hand to meet demand. In the hospital industry, the terms just-in-time and JIT are used to describe a specific approach to inventory management where hospitals essentially outsource the storeroom operation to a JIT distributor. More specifically, in these hospitals, orders for PAR locations and other departmental supply orders are transmitted directly to the hospital's distributor for picking rather than to the local storeroom. When a hospital operates using the JIT inventory model, the distributor allows the hospital to order goods in the lowest unit of measure, such as pack, roll, or each, rather than insisting that all orders be placed using the bulk unit of measure. As orders are received, the distributor will pick the supplies for each order and will keep the orders segregated from each other, typically by placing each order in its own plastic bin or tote. Then the distributor will deliver all the orders to the hospital at a designated time each day. Each order will then be physically received into the local inventory software and will be delivered to the ordering location. Some hospitals allow the distributor to deliver the goods to the ordering location, and other hospitals have their receiving staff perform the delivery. Check with your supervisor to determine if your organization uses the JIT inventory model. What does lean mean? A lean supply chain is a supply chain operating at its very best. It supplies the goods or products to the end customer in the most efficient manner possible, with minimal waste, loss, and with enough flexibility that it can adapt to unexpected delays. What is LUM? Lowest unit of measure, or LUM, is the lowest unit of measure that a good can be broken down to. For example, a case of toilet paper has 4 packs of 12 rolls. The total number of rolls in this case of toilet paper is 48. What is fill rate? Fill rate is the percentage of customer requested line items that a company or warehouse has fulfilled successfully during a time frame without running out of inventory. Fill rate can be calculated by taking the total number of requested line items that were successfully fulfilled, dividing that by the total number of line items requested or ordered, and multiplying that by 100. What is inventory accuracy? Inventory accuracy refers to any inconsistencies between the actual quantity or type of physical inventory and what is recorded or is supposed to be available. What is a back order? A back order occurs when an item is purchased and the item is out of stock or not in the inventory of the supplier, and the supplier or seller holds the order open so that they can fulfill it when additional inventory arrives. Conversely, when the seller cancels the line item they cannot fill, this is called a killed line. What is a contract? Contracts are agreements between buyer and supplier for things such as pricing and volume discounts. What is a purchase order? A purchase order, or PO, is a legal document that is created by a buyer and sent to a seller to confirm their intention to purchase products and/or services. It documents the exact requirements of the buyer in terms of quality, quantity, performance, pricing, and payment terms for the material. What is an invoice? An invoice is a document issued by a seller to the purchaser describing services that have been provided or goods that have been purchased, in what quantities, and at what price. What is an ERP? Enterprise Resource Planning, or ERP, is a term used for comprehensive business software. To qualify as an ERP solution, the software must include modules for human resources, finance, and supply chain at a minimum. ERP tools share a common process and data model, incorporating end-to-end processes such as those found in finance, HR, distribution, manufacturing, service, and the supply chain. What is an item master? An item master is a table within the health system's ERP solution that contains key information about regularly ordered items. In most ERP solutions, all inventory items must be in the item master to effectively manage inventory. Beyond that, each health system decides for themselves what criteria results in products being added to the item master. Types of information stored in the item master includes the item name, description of the item, manufacturer, manufacturer catalog number, lead time, packaging breakdown or unit of measure sizes, including conversion factors, product classifications such as identifying products as wound care or anesthesia, and latex status. One of the key benefits of the item master enables requesters to efficiently order goods for their department. What is a distributor? In the supply chain, the distributors are the ones in contact with the manufacturers. The role of the distributor is that of an intermediary entity between the producer of a product and another entity in the supply chain. What does perpetual inventory mean? This is a type of inventory management where staff members record all transactions each time an item is placed on a shelf or removed from its location. This method of inventory management provides visibility for the staff to be able to view exactly what is stocked, how many are available, how many are on order, and the financial value of the inventory. This approach to inventory management is commonly called perpetual inventory management to emphasize that inventory quantities are perpetually updated in the computer system to reflect the flow of supplies into and out of the storeroom. You will often hear the word PAR when working in hospital supply chain, but what does it mean? The term PAR means periodic automatic replenishment and is used to distinguish these types of inventory locations from storerooms, where inventory quantities are perpetually updated each time an item is added or removed. In a PAR location, the inventory is added and removed without a transaction being required. In PAR locations, the inventory staff must periodically walk through the location and look for items that appear low. They will then count the on-hand quantity and compare that with the maximum stocking level, also called the PAR level. In modern systems, the inventory staff member will use a mobile handheld device to scan the barcode label for the item, key the count into the handheld device, and the software will calculate the reorder quantity. In some older systems and in locations that are managed using paper-based reordering tools, the inventory staff member will manually calculate the order quantity by subtracting the on-hand quantity from the PAR level. The key takeaway for you is to know that the term PAR can be used to designate any storage location that is not a perpetually tracked location. Plus, it can be used to designate the maximum stocking quantity for a given item in a given location. For example, there is a PAR location in the emergency room, or the PAR for item number 554433 is 12 rolls. What does STAT mean? There are scenarios in the hospital environment where a clinician needs a medical supply urgently, but the supply is out of stock in their department. When a clinical department orders a supply from the supply chain department and indicates the item is needed stat, care should be taken to deliver this product as quickly as possible. What is a requisition? A requisition is the request of goods or services by an end user for a purchase order to be created. What is a GPO? A group purchasing organization, or GPO, is an entity that helps healthcare providers realize savings and efficiencies by aggregating purchase volumes and leveraging it to negotiate discounts with manufacturers, distributors, and other vendors. A GPO can help streamline procurement processes and increase buying power. What is EDI? Electronic Data Interchange, or EDI, is the electronic transfer of data from one system to another using a specific standardized format. This method is fully automated, eliminating the need for human intervention, such as keying in orders, invoices, etc. Thank you for listening. We certainly hope that you have picked up some practical knowledge today and that you have a stronger understanding of the supply chain terms you may hear in a healthcare setting. If you enjoyed today's video, please like and subscribe so that we know that you specifically would like to see more of this type of content.